Hi, and welcome to the Psych, Health and Safety podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our guest and topic for today, allow me to introduce my co-host, Joelle Mitchell. How are you today, Joelle?
Jason, I had a phone call from somebody from Gallup wanting me to answer a bunch of questions.
Oh, yeah.
And I was feeling generous, so I agreed. The phone call was premised by, we're living in extraordinary times. So, this kind of research is really important.
Mm-hmm.
And then just proceeded to ask me lots of questions about things like how much per month do I spend on streaming services and what model car do I drive and stuff. So not really pandemic related questions very much.
Oh, but very important.
Very
questions
important,
for the people paying them to collect this information.
They also asked me my views on whether or not marijuana use should be legalized.
Yep.
The question that always throws me, and I feel whenever I do like a census or any of these types of questions, I always feel like a bit of a fraud when I answer this question, because they ask you where your parents were born.
Yeah.
And my dad was actually born in Vanuatu.
Okay.
And when I say that to people who aren't looking at me, I feel like it gives them a very unrealistic expectation of my physical appearance.
Yeah, you couldn't be any smaller or whiter.
That's it. So my father's parents were actually missionaries, and they were working in Vanuatu when he was born over there. So I'm about as white as you can get in Australia. Actually, his mother was able to trace her lineage back to one of the convict boats way back when. So,
wow.
Yeah.
So more Australian than me.
More Australian than you. Absolutely.
Okay. Wow.
Yeah.
Well, I didn't know where that was going. It's gone in a completely different direction. We've learnt a little bit more about Joelle again today, about her heritage, and you definitely don't look like an islander.
No, I don't.
All right. Well, look, we do have people from all around the world, and it appears that Joelle, whilst Australian, is kind of maybe related to the Hawaiians somehow. We don't know.
That's what the census makes it look like anyway. And the census data is all that matters.
And we actually have our guest today who's definitely not from Australia. Okay. So she has a master's in psychology and has been practicing in the field for more than 15 years. She has a wealth of experience in aviation psychology, particularly, having previously worked for Qatar Airways for 10 years. She's authored and co-authored book chapters on the subjects of pilot recruitment and workplace mental health. She's also the founder of the consulting practice Flourishing Minds and is our first guest from the Middle East. Welcome to the podcast, Tina Balachandran.
Thank you very much, Jason. So you pronounce my name as Tina Balachandran.
Ah, okay. Look, look, this is just a rite of passage for the show. I think I butcher everyone's names on the show. So welcome to the growing list. Can you tell us how to pronounce it again? I'm going to listen to this on repeat later.
All right. So, Tina, and the surname goes Balachandran.
Okay, yes. Now, we've actually been connected over LinkedIn for some time, I believe it.
That's right.
Obviously, we have similar sounding or names in our products, Flourishing Minds and Flourish DX. So, yes, I did come across your work pretty early on. But it's, so great to have you on the show. And like I said, first guest from the Middle East.
Thank you very much. I'm really honored to be here. So yes, I think I noticed Flourish DX because I was trying to come up with the name for my business, and that's how I came across Flourish. And I was like, oh wow, Flourishing Minds, and Flourish. There's something out there, and so that's how I guess we connected over LinkedIn. And so I'm really honored to be here, and it's amazing to see the work that Flourish DX has been doing so far. I've signed up for the free resource courses that you've been offering. Haven't completed the first one, I must admit, but it's just amazing to see what the content that you're putting out there, the quality of what you're trying to put out there, and make it more accessible. And I guess that's really important at this point of time. So thank you for the work that you are doing.
No, it's very important, right? There needs to be a shift, as we keep talking about on this podcast, from how we do workplace mental health, from this wellness focus only to incorporating more around health and safety and risk management. We're just doing our bit, hopefully, to broaden the information that's available, not just through the podcast, but as you say, through the e-learning programs that we're putting out at the moment too. So thanks, Tina. And if you haven't gotten onto the training yet, listeners, you can get onto that at www.45003.org. So thanks for the opportunity to plug that training as well, Tina.
Well, and I must say that you were pretty, early on in capturing the 45,003 as a name, because, if you look out for 45,003, you guys just come up on the top. So you can't help miss you guys.
Yeah, it's probably the benefit of working in a startup, and you're allowed to sit around and have a drink at 2 or 3 o'clock in the afternoon, and some really great ideas come up about that point in time.
I know. I've been listening to some of your podcasts, and I think a lot of them talk about all these brilliant ideas coming up over a couple of drinks.
I thought you were going to say a lot of our podcasts sounds like we're drinking at the time.
It could have gone either way, really.
Yeah.
No, there's definitely been a few stories of sort of breakthrough ideas associated with being at the pub. So, yep.
Yeah, not just from us, but from Peter Kelly, Marianne Bainton.
Indeed.
Yeah, it seems to be the trend, both back in UK and Canada as well. So,
yeah.
All right, Tina. Can you tell us, are there any podcasts that you like to listen to?
So, well, I'm not much of a podcast listener, though over the last year, I guess, with the pandemic and everything, podcasts have taken over some of the headspace in terms of listening. So I've heard a few episodes of Psych, Health and Safety. Haven't always got to the end of them, but I've got, a fair bit here and there from the podcast. I also listen sometimes to the podcast from the Gottman Institute, which talks around small things often, and talks about, couples and, interactions between couples and different aspects of relationships, etc. The other bit is pandemic parenting, and that's a recent podcast that I've come across. I have 2 little ones, so it's interesting. I have a 4.5-year-old and a 20-month-old baby. So, I guess some aspects of that is about, self-learning as well, in terms of, how do you cope, how do you respond to children, how do you manage, how do you deal, etc. So, yeah. So those have been some of the aspects. My husband listens to a lot more podcasts than I do.
Oh, interesting. I hadn't heard the parenting one before, but certainly a unique challenge that's been sort of imposed on the world. Absolutely. In the last 18 months. Fortunately, not quite as significantly for us here in Perth. We've been quite fortunate, really. But yes, hopefully it's soon to be behind us.
Yeah, I really feel for those who are doing the remote education. Oof.
Yeah, we did, I think, 3 months of that, and that was too many months for me. So I can't imagine people have been doing it for 18 months.
Yeah.
No.
Well, that is quite a challenge. So I had my 4.5-year-old start her first experience of big school online. So she hasn't met her classmates. So she moved from nursery, where she was very comfortable and she had all her friends and she knew everybody, to an online world where she didn't know anyone. And it's been quite a challenge for her. But, it's interesting how kids adapt. They're more resilient than we think of them to be. I think she coped a lot better with online education than I did. I found it very frustrating to sit there and kind of hold space for what was being done. And I was critical to some extent in terms of what the teacher should be saying and how she should say something different. And, and then I realized, this is probably why we parents are not there in the classroom at school. Because you just kind of have the inner view of what happens within a classroom setup, which I think might not always be the best view that you'd want to have.
Yes. No, I think parents are generally better off leaving the teaching to the professionals, and
absolutely,
we take care of the inner lives. All right. Yeah. So Tina, can you tell us about your professional career, please?
Sure. So growing up as an only child, I spent quite a lot of time observing people. And I kind of felt that, moving into psychology was a natural progression for me. And when I was 13 years, I knew that I wanted to be a psychologist. But the path to getting me onto my career was not a very straight path, because in those days, when you talk about, wanting to be a psychologist, you had so much of pushback from the family. Would you really want to sit and listen to people's problems? You'd have your own set of problems, etc. So I had a bit of a path that I had to navigate before I could get to my master's, in fact. And then from there, I grew up in a small little town in the southern part of India, and opportunities over there was very much lacking. So I started off, working with a multidisciplinary team of neurologists, special educators, working within the field of assessing children around learning disabilities. But I felt that something was missing at that point of time. And I think that was the corporate exposure. And I kind of felt that I needed that balance between, the corporate world and my clinical space. And just one without the other was just not me. So I moved from the small little town to a city, which was Bangalore. And I actually digressed a bit. I worked in the BPO as a call center agent. And, I was selling telecom services to the UK, interestingly. And I still remember a call that I had with a 90-year-old lady who was very thrilled about the fact of talking to someone from India. And she asked me if we had snakes and elephants and if we danced around. And, it was a very funny conversation. And I spent over an hour talking to her instead of making a sale. And so I guess that just proved that I was so much not a salesperson. But the exposure that I got within the call center world was quite interesting, because that kind of got me my next stint within the corporate world as an organizational psychologist. And so from clinical, I kind of moved into that organizational space where I worked for the next 4.5 years developing psychometric assessments for corporates, running focus group discussions, understanding what are the competencies required for job roles, etc. And I led a team of 8 organizational psychologists at that time. And that was my space for 4.5 years. Then I got married and I moved to Qatar, which was a very different experience coming from India. And interestingly enough, again, I kind of just got moved or pushed into Qatar Airways, because five months after I moved to Qatar, I saw this job opportunity for a company psychologist. And I said, oh, wow, this sounds interesting, and there it goes. So I was the first full-time psychologist for the airline at that time. And I had the privilege and the opportunity to set up the psychology department for the airline under the medical center. And I guess that started my 10-year journey within Qatar Airways, which has been amazing. And I had a lot of learning over there. I think my whole interest in workplace mental health kind of grew and developed and got nourished within that environment, because it just provided an opportunity within safety critical roles, being able to kind of bring in mental health, create that awareness that was needed. It took me, so I joined Qatar Airways in 2009, and it wasn't until 2017, 2018 that I was actually able to make a breakthrough, even though I was within the organization and I was actively involved in a whole lot of things. We were able to actually host the first World Mental Health Day within the airline in 2018. So it just says, it takes a lot of time to kind of start creating that change and creating the awareness. But yeah, so that's my whole bit within the aviation industry. And again, I think at a certain point of time, I kind of felt that I needed to step out and, there was still more work to be done. And that's when I explored outside of the corporate world again. Yeah.
Yeah. Well, you said you grew up in India and obviously started working in India before moving to Qatar. How many years have you been in Qatar for then now?
So I moved here in 2009. So that's around 11, 12 years now.
Yeah. So tell us a bit about what is Qatar like for those who haven't visited before?
Qatar is very different. In many ways, because when I first thought about Qatar, desert country, all you think about seeing is desert. But when you come over here, you realize that it's very different, because You have skylines. It's, you know, it's lights all over, and it's kind of, in a way, you feel that there's a lot of you know, made setups, you know, a lot of reconstructed work. You know, it's built in a way that facilitates you know, growth. It facilitates opportunity. And you know, Qatar, when I moved in over here, you know, I kind of felt that it was a very safe place. Coming from India, you'd always come home and you'd make sure your doors are locked. And I remember, you know, during my early days in Qatar, I used to live with my in-laws, and they would leave the doors open at night, and I would keep running down the stairs to turn off, to, you know, lock the doors. And that was my first experience of what Qatar is like. So it's this very multicultural place, which is very open to accepting people within the ecosystem. Right now, you know, it's an independent sovereign state, which is ruled by the emir, and the emir is the head of the state in Qatar. Qatar is, so I was kind of, you know, researching a bit to see if I could give you guys a size comparison. What would that be like, right? So Qatar is 668 times smaller than Australia. So apparently it's a 0.15% the size of Australia. So, you know, in terms of a size comparison, it's a really small little country. 2.9 million in terms of population, where less than 15% are nationals. So the expatriate workforce forms a larger part of the population in Qatar. Interestingly enough, Qatar was also named one of the new 7 wonder cities in 2015. And it's kind of a city where there is art and culture, education and sport is promoted quite a bit. And there's so much of focus on that. I mean, you go by the Corniche area in Qatar, you know, you can't help but miss the number of art exhibits that they have across the city. And just recently, they've had an opening of a falcon at the Hamad International Airport. So, and again, as you walk through Hamad International Airport as well, there's so much of art structures throughout. And so there's a lot of focus on art and culture and education. Would you believe that, you know, they converted a fire station into an, you know, a cafe where they focus more on art. So young budding artists would come over there and they could set up and, you know, create their art. And so they, and you have a fire truck right outside, you know, so it's kind of very transformative from that point of view.
Yeah, interesting. Sounds similar to Singapore, where you have this, you know, small size, but lots of expats and a lot of wealth and yeah.
Yeah. So have you traveled towards this part of the world or passed by any time?
I've gone through on the way to London, but haven't actually ventured outside of the airport, Dubai airport before. So that's as close as I've gotten to Qatar.
To the Middle East. Okay. Well, you should plan of coming over here in 2022 for the World Cup.
Yeah, look, with the way that our premier likes to lock the borders, I don't think we're
back in again.
Yeah, I reckon maybe 2025 the way things are going before we can travel internationally. But tell us more specifically then, what is the state of mental health in Qatar?
Right. So mental health in Qatar is you know, very much still stigmatized. Awareness around mental health is growing manyfold, which is great. In terms of statistics, 1 in 5 will experience mental health issues in Qatar in their lifetime. You know, it's anxiety and depression are the most common conditions that you see over here. That's the most common reported conditions. During this pandemic, there has been a lot more understanding and recognition around mental health, and Qatar as a country set up a national mental health helpline, which was very interesting because the number of people who anonymously called in to receive support was huge, which is very different from what you would expect generally to see in Qatar because, you know, because of the stigma associated around mental health. Again, in terms of, the strategies around what's been happening in Qatar, 2009, when I came over here and I had to get myself licensed, when I went to the Ministry of Health at that point of time, I was asked if I was a nurse. I said, no, I'm a psychologist. Okay, and what do you do? And we've grown so much from there to now in terms of that understanding of what psychologists do. And even within the Ministry of Health, we now have a scope for the work that we do. When I got licensed in 2009, there did not exist any practices around that as such. So mental health is still very much stigmatized in Qatar, but there is growing awareness around it, which I think is great. The youth as well are coming forward and talking a lot around mental health, across the region in the Middle East as well. There was a survey in 2019 that looked at the attitude of youth. And again, found that 1/3 of them knew that someone who was suffering from a mental health disorder. And again, anxiety and depression seem to be a very common mental health issue within the region as well. It's interesting, and I've got this book over here, and I don't know if you could see it, but this talks about the mental health attitudes and awareness in Qatar. And as you can see, that's how thick the book is. And it's both in English and Arabic. But what's interesting is that Qatar has actually done a survey to assess the mental health attitude and awareness of the people. And this survey has been done in 2015, 2018, and 2020. And it's very, very promising and positive to see that there is an increase in that awareness. There's a twofold increase in awareness around that. The stigma still exists. People still worried about talking around mental health and, understanding about whether we have a mental health issue. Do we really need to get help? But I think there is a systemic change that's slowly coming in, and it's a good opportunity to capitalize on that, to create more awareness and engage the community in understanding more about mental health.
So how about from a workplace perspective then? Is it sort of something that workplaces are starting to take action on?
I think workplaces have an understanding that mental health is an issue, but they don't really know what to do about it. Now, I wrote a chapter on workplace mental health in 2019. And at that point of time, trying to find published research was almost, there was absolutely nothing out there. I think there were 3 studies that spoke around mental health in the workplace setup. And the challenge, I guess, is that approximately 90% of the population and 95% of the workforce are migrant or expatriate workers. And they form the highest proportion in the world. And the migrant workforce comprises of low and high-income migrants. Now, low-income migrants are largely the laborer workforce coming in from South Asia. And the high-income migrants are the highly qualified workers who come in into managerial and administrative or professional roles, and they tend to come from the Western world or from other Arab countries. Now, over here, people follow the kafala system. And so the kafala system is a set of migration rules in which you have a sponsor who's your employer, and your employer is responsible for your residency in the country, your ability to change jobs within the country, and your opportunity to leave the country. And so the kafala system operates in a lot of the Middle East region. And that proves sometimes to be a challenge, because from a psychological health and safety point of view, it's psychological risk that you have over there because you don't have the required control that you need. So from a workplace point of view, people then worry about talking around mental health, because if I talk about mental health and I'm seen as not capable to work, then I would lose my job. And the migrant, given that the larger population are the expatriate migrant population, we're all coming over here for work. So if you don't have a job, you can't really stay here anymore. And I guess that itself becomes quite challenging. And I think workplaces, while they recognize the need to focus a bit on, mental health and be able to manage it, I guess they're also, not really aware of how and what they could do and how they could support because of how the systems and the regulations work around it. So I think that becomes a real challenge out there.
Yeah, I was going to ask what do you think are the gaps? And like you said, there's just that lack of awareness or lack of resources. So, what needs to change for workplaces to be equipped to intervene in this area?
I think there needs to be a legal governance around it. When the 45,003 was in conceptualization and when it finally got released, I was kind of researching to see how could we start implementing this in Qatar. What could we do? How could we get employers to kind of buy into the whole concept? And the challenge is there is no legal governance around it. So they're not legally required to do it. And while, employee health and well-being is an important element and is part of the national strategy, it's not mandated. And because it's not mandated and because there is a kafala system, employers in a way do hold a higher, let's say a holding power in a way speaking. And so the government says that, this is something that we need to focus on. There is that recognition, but it's still at the employer level to see how they want to start implementing that. And I think that's where we need to start creating the change. I've been doing a couple of awareness sessions with IOSH Qatar branch to kind of create awareness around, mental health, workplace mental health, the need for psychological health and safety, why we need to focus on it, what could we start doing? And what I always hear back from the participants is a keen interest, but the challenge is to take it to the next step and get employers to kind of buy into the whole approach and the idea. And I think that's a huge challenge in Qatar.
Yeah, I think that's a global challenge. I mean, the carrot has been used for so many years. There's so many ROI type reports done by big four consulting firms around, if we do invest in this, what do we expect to get back in terms of productivity? But it doesn't seem to be working. And that's why we're seeing regulators becoming more active in this space. So in Australia, we're seeing legislation, regulations being updated over the coming months and year. UK HSE seems to be getting a bit more proactive in addressing this with the employers over there. So it's a bit of both, right? And it sounds like you can probably help having a bit more of a stick there rather than purely just education and destigmatizing.
Absolutely. And I think that's the whole bit, because we don't really have a governing body over here like the HSE or, the standards that you have in Australia. So there is no governing body here as such. And I think that's again, a gap, because I think it's really important to have a governing body. We have work groups and task forces that have been formed to focus on occupational health and safety. But, and they are doing a lot, to give them credit, they are doing the best that they can within the systems that they're working with. But there is still so much more to be done, So
you mentioned the national strategy. Can you tell us a little bit more about that and sort of what's happening at a country level?
Sure. So in 2013, I think, in 2013 is when Qatar's first national mental health strategy was published. And within the strategy, they recognized that health and wellness of employees was really important for the economic growth of the country. And the vision that was articulated was for an integrated mental health system with an approved mental health law. Now, they put together a mental health law, which is currently in its implementation stage. Further from there, they also came up with a health and well-being strategy, National Health Strategy of 2018-2022. And they identified 7 priority populations, 2 being mental health and well-being and health and safe employees. And again, the strategy highlighted that mental health and well-being enables people to be more actively engaged in society, work productively, and contribute to the communities. We had a World Innovation Summit for Health, the Wish Qatar in 2018. And again, the importance of mental health in the workplace was emphasized. An add-on to the National Mental Health Strategy was a National Mental Health and Wellbeing Strategic Framework of 2019-2022. And over here, mental health was one of the 16 priority areas for the public health agenda in Qatar. And the focus and priorities has been around positive dialogue around mental health and well-being, raising awareness to reduce stigma, creating a difference in mental health and well-being outcomes in the life of people, and creating partnerships with key stakeholders. And as a health system, what Qatar has been doing is making it more community-oriented services, as opposed to having to go into the mental health facility, for an appointment. Primary healthcare centers have been developed and trained with staff to help identify mental health issues, be able to provide the first level intervention before referring them to a specialist, which is great. And you also have psychiatrists and community mental health professionals moving into the community to again create that service provision over there. So I think those have been some really good measures that have been focused on within Qatar. I think there's also a continued understanding on the need to improve data around mental health in Qatar. And so there are quite a few research initiatives that are in place to kind of gather that data, which I think is really important. And an integrated model of care. And I'm very happy about the fact that there is a focus on an integrated model of care, because I'm very much a believer of that systemic approach to well-being and health. And so that's, again, something which is a focus around here. And I think implementation of the National Mental Health Law, that's another part of the strategy and focus within that framework that they have.
Yeah, so it sounds like there's quite a lot going on then.
Absolutely. There's quite a bit of work. And I think that's, what's really interesting is the vision that Qatar has as a country. I think they have a very strong vision. It's about, being able to implement it, having the right support systems in place. I recently spoke to the lead of the National Mental Health Strategy, and we're trying to create a wing around community initiative, because I've had, members from the community reach out to say, how could we work together to create more awareness? How could we create a safe space for people to start talking about mental health? How could we help break some of the stigma? So we're kind of seeing how we could work together with the strategy team from within the community to start creating some of that change as well. Because I think our voice needs to be out there, and it's not just the big guys playing, being the big major players in the whole process. And I think that's really important as well.
So it sounds like there's sort of at that high government level, there's stuff going on. At the community level, there's stuff going on. And so it seems like the organizations, and the big employers, it's their time to step in and sort of start making their contribution as well.
Absolutely. And I think that's where that gap lies, because you have the government having all the vision, and they're all partnering with other governmental agencies or partners, and they're all contributing to it. But from the community, there is not much of that active involvement and engagement with the bigger players. So I guess that's an integrated gap that needs to be bridged, in a way speaking.
Do you think it's partly because there's so many multinational companies within Qatar, and the decisions are made not in Qatar but elsewhere in the world?
That could, well, as you mentioned that, I'm just thinking, and maybe that is a possibility. However, a lot of the companies in Qatar are Qatar based as well, because in order for you to hold a business or have a business in Qatar, it needs to be Qatar based in terms of ownership and functioning as well. And there are quite a few big players from the oil and gas sector, aviation, obviously there's only one airline, but they're all based in Qatar. And even within these big organizations, you still find these same systemic gaps. In fact, Qatar Airways is the only organization outside of the healthcare system that has an in-house team of psychologists. Right? So even within the oil and gas sector, you don't really have an in-house team, and maybe this is how it is in other parts of the world as well, in terms of big organizations might not always have an in-house team of psychologists. However, I think they have the difference. What I think is that in other countries there is access to resources, whereas in Qatar, given that it's a small country, access to those psychologists are also limited. So I guess that becomes another challenge in itself. Capacity building is something, again, which needs to be done over here.
One thing you mentioned earlier, Tina, was how you like the systemic approach to workplace mental health, and obviously that's a large focus within the new ISO 45003 standard. So how ready do you think Qatar employers are to start to look at that standard and implement that standard?
I think employers in Qatar have a longer path carved out for them before they get there. The ISO 45001 is still being implemented in some of the larger organizations. And that's a priority area that they're currently starting to look at. So I think we've got a long way to go. And I'm aware, and I do recognize that you don't really require to have the ISO 45001 completely in place in order for you to adopt the 45003.
Correct.
But that being said, I think it's about that awareness piece, right? Because if you're not really focusing on occupational health and safety as much as you should be, mental health and the focus around mental health and well-being itself becomes another challenge. So again, I will go back to saying, creating awareness and having that education piece is where I think there is some level of that would probably be the starting place from my point of view.
Yeah, I mean, it may not be the worst timing really if they're implementing 45001 currently to look at how do they do 45003 at the same time, because really it's about setting up your safety management system, and this is just about incorporating the psych hazards into that.
Yeah, I guess the issue is probably around sort of maturity of understanding about risk management, and if they're still sort of developing that knowledge or understanding of risk management in relation to sort of physical safety hazards, and extending that to psych safety hazards might be more of a challenge.
Yeah.
Don't know.
Yeah.
We shall see.
Yeah.
I very much see, like you've said, Tina, it probably is a long path, and they probably will do them discreetly, 45001, and then maybe look at 45003 at some point in the future.
Yeah, I'm fingers crossed. I'm hoping that we would definitely get to 45003 sometime in the future for sure. So yeah.
So you've mentioned a few times about sort of the volume of expatriate workers in Qatar. Do they sort of have a unique profile as far as the psychosocial risks that are present for them? You've sort of mentioned the challenges around job security in coming forward with a problem. Are there any other psychosocial risks that are unique to this group?
I think yes, because, I think it's also about the organizational culture and the functions that they have, because, if given that low control that they have around the job, high workload that they would have, issues that they would have with the employer, arguments, complaints, dissatisfaction with what's being provided, how it's being provided, has been identified as a risk factor for them developing depression as well. So in a study, they found that if you've had an issue with your employer within the last 3 months, there was a higher risk of your employee developing depression. I guess another aspect is the interpersonal relationships at work, given that you come from diverse cultural backgrounds, there's always that scope for misunderstanding, culturally, not being sensitive to a co-worker. One of the other bits is because a lot of the low-income migrant workers move to Qatar, they don't have a family support system. And so, the adjustment, how well do they adjust to Qatar as a country? The lack of family support in the process, lack of peers to support you in how you would normally cope and adjust back home. So I guess all of those play its own element in that risk within that framework of interpersonal relationships. There's also lack of development from a career development point of view. A lot of them, especially the low-income workers, they come at a specific job role and they probably remain there for a really long period of time. The opportunity to take breaks, to go home, to go back to family is also missing within the low-income workers. Many of them go home maybe once in 2 years, once in 5 years. And so, you really are very, very separated from, your support system. And within that low-income worker group as well, quite often, you do see financial strain because they're here for work, they have loans, responsibilities back home. And so not being able to cater to that adds on to that personal stress and pressure that they experience. So, that homework interface kind of makes it really, really hard and challenging for the lower income workers. For the high income workers as well, that the lack of control is a strong element that you face over here. Just makes them more vulnerable to the impact that it has on them as individuals, as employees. The environment that they work in, the equipments that they have to help them in the process. Like, I was talking to a few frontline workers who've been involved in cleaning and, housekeeping during the pandemic. And this is not specifically in Qatar, but I've been listening to, some of the experiences coming in from the region as well. And they've been talking about how during the pandemic time, just not having access to PPEs to help them in the process, right? I mean, the expectation is that, it's okay for them to be out there. And I guess that's where there is a lack of employee focused approach. It's very much task focused and task based, and how it's about you're here for a job and you need to get the job done, as opposed to, the human element and the human touch to it. But that being said, I think there is, again, a recognition of the need for that change. I've visited a few organizations to kind of do a site visit and see, what's the kind of work like and working structure like. And I was very impressed to see in some of the construction companies, the level of engagement and the environmental change that they've created to make it more employee centric and more focused on people. Like they have recreation rooms, they have, facilities where people have access to computers so that they can connect back with families, because again, think about low-income workers, they don't really have the affordability to have all those access that you would expect. So organizations actually creating a facility where they have access to computers, where they could learn and build on the computer skills in order to develop themselves, so that you have that learning and development aspect that is being catered to within the well-being elements, right? So, so there are some organizations who are trying to create changes. Again, even the basic things of food. You're a multicultural group of people, and having access to the food from your own country within your workspace, right? Because you're working long hours and you might not have the capacity or the capability or the headspace to kind of cook and carry your food. And so just having organizations provide that as a facility, as an add-on for the employees, can be really helpful. So I think there are some unique challenges that contribute to employees facing more challenges at workplaces over here.
Yeah, that's great to hear some of those initiatives that they're starting to look at or have been doing for some time to make people feel more at home, and trying to deal with some of these psychological hazards that are, I guess, particular to the expatriate population. Well, one of the other issues with expats, obviously, is that they tend to move around a fair bit. So how do you go about designing workplace mental health initiatives that are sustainable if you have this regular movement of employees in and out of a company?
I think that's a unique challenge in itself, right? And currently there is no system that is focused on that in terms of a design or a solution. But when I think about what I think it's about being able to involve the employees, involve the workers in designing those solutions, because they are the people, they are the front end people working, and it's about getting the answers and solutions from them in terms of how could we improve the system, what changes can we bring about, and I think listening to them becomes really important in creating that sustainable process, right? And a lot of times, especially over here, I mean, there is a lot of focus on sustainability, but it's all environmental sustainability, right? And being able to kind of bring that back into, the workplace and talk about programs and initiatives that could also be sustainable. I think it's about looking at, workplace mental health as a corporate social responsibility in a way speaking, because I think the minute you look at it as a corporate social responsibility, you start thinking more in terms of how could you then build on those social elements that are there. I think when you focus on it as being, something that has to be ticked off, then it becomes a bit of a challenge. I don't know what your thoughts are about that.
Oh no, definitely the S is often missing out of the ESG. It's not just particular to Qatar. I think that's a global thing. But there are people who are trying to move the needle on that. But yeah, the bit that you mentioned about consultation, that's really key, right? I do see sometimes companies are scared about asking employees for their input because they're worried about what sort of things might come up, and are they actually going to do something with this feedback? But it's so key. Otherwise, you just waste your time and money, doing interventions that don't actually move the needle or address the issues that the employees have. So yeah, that consultation piece is certainly key.
So you gave a few examples there of some things that organisations are doing particularly for the expatriate workers to sort of help them address some of the challenges that they're experiencing being away from home. Have you got any case studies or examples you can share of organisations who have sort of taken a prevention approach to mental health at work?
Sure. I think one of the programs that I found very interesting was a worker welfare program that was run by an oil and gas company in Qatar. And they focus on not just the physical aspects of health and safety, but also the mental health aspects. And they kind of had a very holistic, very integrated approach, starting from basic general services of food, nutrition, catering, accommodation, housekeeping, laundry, maintenance, to information and community services, event coordination, sports and recreation, and delivery of psychological support. Now, the interesting bit over here is that they created a welfare team that was headed by a village mayor. And so that's how they designed the program. And it initially included professionals, but then later was supported by resident volunteers. And within the program, they kind of established a counseling and consultation service, a 24/7 mobile helpline, a village uncles and aunties program with resident worker volunteers as a first line of support. And I think that really worked well because they were able to train the village uncles and aunties, as they referred to them, to identify, relate and manage difficult and sensitive issues so that they were able to intercept those issues before it kind of escalated. And over a 2-year period, they dealt with, I think, over 1,600 cases or 1,600 touch points, as they referred to it. And within that over 1,600 cases, they were able to avert 320 risk cases, 25 non-fatal self-harm cases, and there was one suicide that was recorded over the 4-year project, which I think is really great because again, it goes back to saying, and you involve the people and you bring in the community as such, or your employees together, you have, the scope for creating and making a difference is almost, it is higher at that point in time, right? As opposed to the management deciding, okay, this is what needs to be done. You kind of trained people from your community within the organization to kind of respond as peers to help and respond to challenges that people were facing. So I think that was a very good case example that I see in terms of a preventive and promotion, because over there they were educating, they were creating those touch points to prevent something from escalation, from averting a risk situation, in a way speaking. So that I think is a very powerful one for me.
Yeah, that's a great example. I think there's lots of different elements to that, lots of different threads, and I think that creating a community in that organization, because obviously, the petroleum work is often you've got a group of people who do sort of live together and work together largely in isolation from anyone else. So creating that sense of community and having it actually run by someone who's a town mayor, and thinking about how to create those sort of community structures would have a really significant role to play in facilitating positive mental health, and the way that people view each other, not just as colleagues but as community. And thinking about also those other services that you mentioned, not necessarily, you wouldn't think of them as psychological services, but they're still stressors. If you've been working a long day and then you have to cook your food and you have to do your laundry and you have to do all of your other stuff that you do that's not your work job, if you've got something that's able to relieve some of that stress and pressure, then that's also protective of mental health overall. So there's a lot going on in that example.
Yeah. And I think also what was important was having community speakers who could speak your own language, because again, it's a diverse and a multicultural group of people working together, right? So I guess just building that service line in was also a very important and a key element and factor. I would also like to share, another case example, which I feel very proud about implementing, because it was within the airline, and it was very different in terms of what we were able to achieve. But I guess over there we kind of had a top-down approach, getting buy-in from the senior leadership and building a case to support the need for mental health initiatives at work. And what we were able to do was we were able to kind of create health and safety policy within the framework of health and safety, and include mental health just as much as physical health. And so we had commitment from the leadership to create a psychological healthy workplace. And as I said, in 2018, we held the first World Mental Health Day within Qatar Airways, which kind of spearheaded a lot of the initiatives from there on. We then were able to hold a workshop for all new cabin crew who were coming into the organization, because again, if you look at the population of cabin crew, young boys or young men and women actually moving into a very different country, leaving their home probably for the first time, and coming and adjusting within a very different culture, very different rules and regulations that they would need to follow and work through, and just helping them understand, what are some of the challenges that they would face, how could they prepare for those challenges, what's the support system available. So that awareness piece was very strong in what we were able to do. What it also helped was, because of creating that awareness, we were able to identify those who were probably coming in and struggling a bit, and they were able to get that initial support rather than going into the system and getting lost within the work world and, their regular crew life. It also helped create awareness about the existence of the psychology team. And so people started becoming aware that, okay, if we had an issue, we could approach. So also creating awareness helped in people calling in then, asking for help. So the number of self-referral cases increased, as opposed to people being referred in. People actually actively calling and seeking for support was something that we were able to achieve. So again, I think there is a lot of scope for creating that awareness within the workplace. I think it's about, having people take the initiative to start that change. I think that's really key.
Yeah, that's great. And I think, what you've done there is, identified a group of workers who are potentially more high risk, and that they're coming into the industry and the country for the first time, and they're still, quite young, and you've actually embedded those protective practices right through from the very beginning in their onboarding. So you're almost creating in that group that culture of, seeking help when you need it, and not getting into a culture where it's already stigmatized and then trying to get them back out of it again. But you're already sort of creating that norm that, this is what we do when we're struggling.
Absolutely.
Terrific. Tina, you've obviously been, really doing a lot of really good work over there in the Middle East and Qatar specifically in this space, and really hoping to move the needle a bit and to bring companies along for the ride. So what would your hopes for the future look like for Qatar and the Middle East in relation to workplace mental health?
Well, my vision is that, one day people would just talk around and talk about mental health and just be very comfortable about it. But, obviously we have a long way to go before we get there. And I think this is a global bit. It's not just unique to Qatar in terms of, the stigma associated with mental health. But what I'd hope to be able to achieve in Qatar is for organizations to recognize that it's okay to talk about mental health, and it's okay to, focus on mental health, and it doesn't have to be mental illness. I think just creating that shift from, identifying and working with somebody who's mentally ill or is depressed or anxious, and rather than getting there, being able to start way before and talk about mental health and start implementing well-being programs and practices, and bringing about an understanding of, within that risk assessment, you need to ask about mental health, you need to ask about psychological aspects, you need to start creating your work and designing your work around creating that healthy workplace. I think that's what I'd really like to see as a systemic change coming about over here. And I'm positive that we can get there, because, as I said, the country has a really good vision. It's about identifying key players within industry sectors, within not just the government, but also within the private organizations, the public health system, being able to identify key people who could start creating that change. So I'm very positive about, seeing that change. I know it's a really long way to go, but it's good to see, hear, and get those feelers that people recognize that it's something that, I think the pandemic has helped in a way, speaking of creating a little bit of an up there, with employers also recognizing that they need to do a bit more. So, yeah.
Great.
And do you have any words of advice that you'd like to share with people who are interested in working in the field of workplace psychological health and safety?
I would say go for it. This is a young and growing field, and there's so much potential out there. There's so much of opportunity to create change, and I think it's an excellent opportunity to, be a part of the system where you could influence and how people can engage with work. We spend a lot of time at work, and it's about building that relationship with the work and the workspace, which can be healthy, and create that recognition that mental health needs to be addressed. And it's not just around, physical aspects and work aspects and finances, but just bringing about that healthy system that you could function with. So I would say that, this is definitely a field to go for.
Well, obviously we agree with you.
Yeah, there's room for plenty more. That's
Absolutely.
For sure. Absolutely. Tina, it's been lovely talking with you today. Thank you for being so generous with your time and sharing your experience with us. It's definitely been a unique take today. Really, really benefited. And I think our listeners would agree that it was a great conversation to have.
Thank you, Jason Joel. I enjoyed talking to both of you as well. So thank you for this opportunity to talk about, the space that we have here in Qatar around mental health and psychological health and safety. So thank you.
Where can our listeners find out a bit more about your work?
Well, I guess they could go to Flourishing Minds .net, and that's the website that I have. The website is undergoing a couple of changes because I think, again, I as an individual am recognizing that it needs to be more of a social enterprise in terms of being able to create this change. So my focus at this point of time is being able to, under Flourishing Minds, bring about that systemic change by creating awareness around mental health, breaking the stigma around workplace mental health, and improving access to services, within the clinical space as well as the corporate space. And so as part of that, I'm currently engaging with the community, with the healthcare system as well, to bring about that change, and collaborating with other partners, not just in Qatar, but within the region as well, to kind of bring about that systemic change. So there is some good work that you're going to see from Flourishing Minds Qatar as well.
Sounds like it.
Yeah. Would there be links to some of the work you've done with IOSH on that site?
It's actually, no, not yet. But that's a good bit, because the work that I've done with IOSH is on IOSH Qatar branch site. And so that's generally accessible to the members. But that's definitely something I will look into. So thank you, Jason, for raising that. I will make sure that's available on the Flourishing Minds website as well.
Terrific. Well, thank you again so much for your time. And listeners, that brings us to the end of this episode. So don't forget, we do record these things over Zoom and do publish them on our Flourish DX YouTube page. So feel free to go over there and check out the video. If you don't like watching a full hour's worth or listening to the long format podcast, we've got you covered in that we have a little 2 to 4 minute segments that we splice up and put on the Flourish DX LinkedIn page as well. So head over there if you want to check out some of the nuggets of gold shared by Tina on today's podcast episode. While you're on LinkedIn, Joelle and I are very active on there, and I've seen Tina very much active on LinkedIn as well. So feel free to connect or follow us on LinkedIn. But thanks again, listeners. We'll catch you next episode.